Hello students, welcome back. I'm Dr. Gaurav and today we'll be doing the cervical vertebrae. So how do we identify a cervical vertebra? We identify a cervical vertebra because it has got a foramen in the transverse process. So this is the transverse process and this is the foramen in it known as foramen transversarium. The vertebra will be small in size and it will have a foramen in the transverse process. So somebody asks you, how do you identify a cervical vertebra? Simple answer, it has got a foramen in the transverse process, which is referred to as foramen transversarium. So how do we identify a thoracic vertebra? Thoracic vertebra is identified by virtue of costal facets on the sides of the body, and these costal facets are for the ribs. So this is how we identify a thoracic vertebra. Lumbar vertebra is identified by exclusion. That means there are no facets on the sides of the body and there is no foramen in the transverse process. The size of the vertebra is large as it is weight bearing. The sacral vertebra are 5 in number and they are fused to form the sacrum, while the coccygeal vertebra are 4 in number, which are fused to form the coccyx. So now we concentrate on the cervical vertebra. So there are 7 cervical vertebra. Out of them, vertebra 3 to 6, they are typical cervical vertebrae. So typical cervical vertebrae, they have got, what do they have? They have a body which lies anteriorly, and this body has got a anterior surface, posterior surface, superior surface, and inferior surface. So the body is there, and then there is the pedicle. So this is the pedicle, and this is the lamina, and I'm holding the bifid spine between my fingers. So we have body, pedicle, lamina, and the bifid spine. The transverse process has got a foramen referred to as foramen transversarium. So we have the superior and inferior articular facets. So this one is the superior articular facet, and here we have the inferior articular facet. Let me show you by articulating the two vertebrae. So now I have articulated the two cervical vertebrae. This is inferior articular facet of one articulating with the superior articular facet of the one below. So this is how it is. Cervical vertebrae. Seen from above, they'll be seen like this. So 3 to 6 are the typical cervical vertebrae. You can make out in each typical cervical vertebrae, the body is much smaller than the vertebral foramen. So this vertebral foramen is larger in size compared to the body. And then the spine is bifid. And this is how a typical cervical vertebra is. Now, in the examinations, frequently asked is atlas vertebra, which is the first cervical vertebra. It is an atypical cervical vertebra. Why it is atypical cervical vertebra? Because it has got no body, no spine, and it has got a it is ring shaped, So it has got no body. You can make out there is no body of the vertebra. This is a typical cervical vertebra clearly having a body. So there is no body here. There is no spine. So the spine is there in a typical cervical vertebra. It's not there. Okay. So no spine. And then this is ring shaped. So this, how do we keep it in the anatomical position? How do we keep the atlas in the anatomical position? The anterior arch is smaller compared to the posterior arch. So out of these two arches, this arch is longer. So this will be the posterior arch, while this is smaller. So this will be the anterior arch. And then these facets, they are rounder, while these facets are elongated. So we have to keep the elongated facets upwards. So superior articular facets are elongated and the anterior arch is smaller compared to the posterior arch. So now I have kept the atlas in anatomical position. Two things I have to keep in mind, that the anterior arch is smaller. So it will be like this. And the superior articular facets are elongated. So once I satisfy these two conditions, that means I've kept the atlas in anatomical position. Now, why is the atlas called atlas? Because Greek god Atlas, he supported the earth on his shoulders. Similarly, this atlas vertebra has got elongated superior articular facets. on which rest the occipital condyles. So the skull is resting on the atlas. So that is why it is called the atlas, because it is just like atlas supported the earth, the atlas vertebra is supporting the skull. So the analogy is with that. Now this is the atlas vertebra. Now it has got an anterior arch, which is smaller compared to the posterior arch, which is larger. Now this anterior arch on its posterior surface has got a facet here. And this facet is there for the dens of the axis vertebra. And the posterior arch, its upper part is grooved. And this grooved part is for third part of vertebral artery and first cervical nerve. So here lies third part of vertebral artery and first cervical nerve in relation to the posterior arch of the. So this is anterior arch. This is anterior arch. This is posterior arch. So superior surface of posterior arch, here lies the third part of vertebral artery and first cervical nerve. This here is called the lateral mass of the atlas vertebra, which I am holding. So it comprises of superior elongated articular facet, inferior articular facet. So superior and inferior articular facets are there. Processes are there, and it has got an anterior surface and a medial surface. To the medial surface is attached an elevation is there on the medial surface. This is for the transverse ligament of atlas vertebra. So what happens is that the axis vertebra, it articulates with the atlas like this. Axis vertebra has got a tooth-like process, and the transverse ligament of the atlas, it passes behind the tooth-like process of the axis. So anterior arch is in front of the tooth-like process, and transverse ligament, it passes behind the tooth-like process, getting attached to the medial surfaces of the lateral mass of the atlas. So atlas has got a lateral mass comprising of superior, inferior articular facets, and it has got this lateral mass has got an anterior surface and a medial surface. The transverse process has got a foramen transversarium, and this atlas vertebra is called atlas because it is supporting the weight of the skull. The type of joint between the articular facet of superior articular facet of atlas and occipital condyle above, this is known as Atlanto-occipital joint, and a yes movement takes place, or nodding movement like this takes place at Atlanto-occipital joint. So the superior articular facet of atlas is participating in the formation of Atlanto-occipital joint. Yes movement takes place, and this type of joint between the atlas and the occipital condyles, it's a condylar joint. So it is a condylar joint, or we can say ellipsoid joint. So ellipsoid joint is formed between the superior articular facet of atlas and the occipital condyle. And which movement is possible at Atlanto-occipital joint? Nodding movement or yes movement. So after that, we come to the axis vertebra. So before that, one reminder, which structure passes through the foramen transversarium of the upper six vertebra? Which structures? Vertebral artery, vertebral vein, sympathetic nerve. Which structure lies in relation to superior surface of the posterior arch of the atlas vertebra, third part of vertebral artery, and the first cervical nerve? Which structure lies in relation to the anterior surface of the lateral mass of the atlas vertebra, first cervical nerve, and the accessory nerve? So you have to remember this thing. And what is attached to the impression on the posterior surface of the anterior arch of atlas? The odontoid process. Where is the transverse ligament of atlas attached? To the medial surface of lateral mass. It forms a sling around the odontoid process of the axis vertebra. So sort of sling is formed here like this by the transverse ligament of atlas posteriorly. So now we come to the axis vertebra. This is identified by a tooth-like process known as the odontoid process. This is called axis vertebra because the atlas with the occipital condyles rotates on it like this. So no movement is possible at Atlantoaxial joint. So yes moment is a positive moment. So that is happening at the first joint, Atlanto-occipital joint, while no moment is a negative moment. So it happens later at the Atlanto-axial joint. Now this axis vertebra has got superior articular facets. They articulate with the inferior articular facets of the atlas. This axis vertebra is identified because of the odontoid process. And when this odontoid process articulates, the anterior surface of the odontoid process has got a facet which articulates with a facet on the posterior surface of the anterior arch of atlas. The posterior surface of odontoid process is grooved by the transverse ligament of atlas, which is getting attached to the medial surface of lateral mass of atlas. And a pivot joint is formed here, which is called median atlantoaxial joint. The joint which is formed between the odontoid process and the ring structure formed by the anterior arch of atlas and the transverse ligament of atlas. This forms a pivot joint. So this is called median atlantoaxial joint, while the lateral atlantoaxial joint is between the inferior articular facet of atlas and superior articular facet of axis. This is a type of plane synovial joint. So this atlantoaxial joint has got two types of joints: median pivot joint and lateral between the inferior articular facet of atlas and superior articular facet of axis. The two joints, lateral joints, are plane synovial joints. So this axis vertebra is there. It is identified by the tooth-like process called the odontoid process, to the apex of which is attached the apical ligament of dents. So this is the axis vertebra, and this is the atlas vertebra, which is ring-shaped, and this is how they articulate with each other. And at the same time, I'll be holding the two typical cervical vertebra and showing you their articulation with each other. So here I am having the typical cervical vertebra articulating with each other, and here I have the atlas and axis articulating with each other. So remember, yes movement takes place at Atlanto-occipital joint, while no movement takes place at Atlanto-axial joint. So then we have another atypical cervical vertebra after first and second, that is known as the seventh cervical vertebra. Now, how do we identify the seventh cervical vertebra? Seventh cervical vertebra is identified because of its long spine, and that spine is non-bifid. So it has got a long spine and the spine is non-bifid. So I have with me this seventh cervical vertebra. So this can be felt in the lower part of the neck at the back, the spine. It is non-bifid, and the foramen transversarium of the seventh cervical vertebra, it transmits the accessory vertebral vein. Now, students, it's very important to know what not to study. So when you are doing the cervical vertebra, so many things are given. For an undergraduate, I think if one is able to articulate the cervical vertebrae with each other, one is able to identify the typical and atypical cervical vertebrae, identify the parts of the typical cervical vertebrae, and tell structures passing through the foramen transversarium of a typical cervical vertebrae. And then if one is able to make out the features of the atlas and identify the types of joint between the atlas and occipital bone, atlas and axis bone, one is able to identify the features of the axis bone and the features of the seventh cervical vertebrae. I think this is sufficient at undergraduate level.